video describes how to use the Child and Youth Eating Disorder Care Pathway. The Care Pathway is a comprehensive hyperlinked document which includes links to tools and resources supporting the child and youth eating disorder management. There are links to equity, diversity, and inclusion information. Information and tools are included linking to prevention, screening, assessment, and common investigations. Details of how to do an acuity assessment are part of the pathway and describe things like orthostatic vitals, blinded weight, medical instability parameters, tools to assess suicidal risk, and how to assess weight and BMI with a parent observed history form. Criteria for involuntary admission are available, as well as parameters to assess acuity to determine emergent or urgent referral. There is also a link to more tools and resources for those who are medically stable, not requiring more urgent intervention. For those with Pathways BC login, there is a direct link to the Point of Care Eating Disorder Care Pathway. This is a tool that leverages the function of Pathways BC platform, identifying local and regional eating disorder supports for your location. Doing a deeper dive on the care pathway, each of the quick link buttons links to either individual documents or to linked lists of curated information relating to the topic, such as prevention for clinician, patient, and family, or coach or educator. Management, which we'll go into more detail later, but includes outpatient management, both the basics, beyond basics, emergency room management, and inpatient management. There are links to clinician information, such as basic information management, and patient and caregiver information. There are also details on clinician training and education opportunities. As we've seen before, this link takes us to a document on equity, diversity, and inclusion, and also has links to racialized or LGBTQ communities. Note that clicking on the return button always brings us back to the front page of the care pathway. Language awareness includes links to deeper dives on motivational interviewing and emotion coaching for caregivers. Language awareness includes examples of what supportive language might look like. Any blue underlined word or group of words links to more information on that topic, such as with bias. On the left-hand side of the care pathway is more information and many tools, such as for presentation, common presenting features, or psychiatric comorbidities as shown here. Under screening, there's the eating disorder screening tool, Screen for Disordered Eating. And the DSM-5 criteria for eating disorders. There are many tools for comorbidity screening, such as the PHQ-9 for youth for depression, which is fillable and auto scores. Other tools include assessment tools for anxiety, suicide risk, substance use, and autistic traits. There's initial visit template, as well as other tools to support assessment, such as the Parent Observed History form, as mentioned earlier. Common investigations include lists for initial labs, and ECG, as well as for medical imaging. In the middle section of the care pathway is information on how to do an acuity assessment, including mid-upper arm circumference measurements and measuring orthostatic vitals. As well, there's information on determining medical instability criteria, psychiatric or suicide risk, calculation of percent premorbid weight, and percent median BMI calculations. Apps are included that you can link to and download for your smartphone for both Google or Android. The criteria for involuntary admission under the Mental Health Act of BC is also included. And the care pathway gives you information to determine whether or not a patient is high acuity or extreme acuity, with links to resources and referrals. If a patient is medically stable, we can click and go to the next page, which includes the previous quick links, as well as a link to referrals, which has a button at the top that allows you to print out all the referral information, including phone numbers and email addresses. That button, when you see it, clicks out only the information on the topic in the document. There's other information on menus and food intake, as well as templates for the initial visit, follow-up visit templates, specialist triage templates, guide to community medical follow-up, and team care communication cover letter. When we look at the specialist triage template, it has information helpful for the specialist to be able to triage the patient and record the referral process. There's more information under outpatient management. The basics includes goals, visits, meal support, medical management activity, medication treatment, and more specifics on medications. In outpatient management, there's also a section on beyond basics, such as when you're dealing with patients with more specific or issues that require a slightly different approach, such as with boys and young men. The emergency room management has practical resources, which include other links. And inpatient management has communications tools, and some practical resources. There's also some higher level information on the approach to take for office management of a patient with eating disorders, and links to consistency, language, and sensitivity that we've touched on before, as well as information on transitions from a patient from child and youth to adult, including the Specialized Eating Disorder Program referral forms and website. Finally, there's information on how you can participate in research for child and youth eating disorders. We hope that this video has been helpful to you in being able to navigate the care pathway. Really, the only way to become comfortable with the pathway is to try it out yourself. As mentioned, there is the link to the point of care pathway on Pathways BC, and also a link to this video by clicking that button. Thank you for your time.